Hi everyone, so it's Friday. I am feeling extra lazy for some reason, so I decided that I need to film something so that I feel less lazy. One highly requested suture is the continuous and the continuous interlocking suture, so that's what we will be doing today. Friday fun day, I decided to use this really cute filter of candies. Yeah, so we'll get started. Alright, let's do the continuous suture today. Let's go in from the buccal out on the lingual like so. And the first step for continuous is you do a simple interrupted. And if you don't know what that is, I have a video tutorial of that. So this is the simple interrupted suture to start. Trying to look over my camera here because I have it really close. Alright, so that's the simple interrupted. So continuous is pretty easy. Just think of it as continuing the simple interrupted. So you don't want to cut this off because then it's game over, right? Then it's just simple interrupted. So you just go in and out again. In the buccal, out the lingual. And you pull. And you want to have this tight. In and out. And you do this until you're happy. You just keep going again and again. In, buccal, out, lingual. And this is good when you have like full mouth extraction, but I still like the continuous interlocking more. Not only does it look prettier, but it also gives it like another secure, because of the interlocking part, that doesn't come off that easily. But you can position this where you want it, so like that before you pull. And then again, in and out. This is actually pretty therapeutic for a Friday afternoon. But I think I'm going to stop here because I can go on and on, right? Alright, so this is where you want to pay attention because you want to keep this loop. See this? You want to not pull it all the way through, but to keep this. So let's pull, but keep this there. And we want to tie it off if this is where you want to stop. Pretend that's one thread by itself. And this is what you do. Ta-da! And then do that again. There you go. And then one more. And then you cut it off. And that's it. That's the continuous suture. And next time we'll talk about the continuous interlocking suture, which is what I like to do. Alright, have a good day guys. Bye.